Thank you all for coming. We do have Chris Patterson and Gregory Andrews with Hemosure Incorporation.
Yeah. Everybody, can everybody hear me okay? Okay, thank you for coming this morning. My name is Chris Patterson. I am a product developer and VP of marketing at Hemosure Incorporated. We are a diagnostic company based in Los Angeles, California. So let's talk a little bit about this. This is our looking forward statement. Go ahead. Hemosure, as I said, it's located in Los Angeles, California. We are a private company. We focus in immunoassay diagnostics. It's our primary business. Our company's been around since 2003. We've been private this entire time. Our primary product is what we call the Hemosure iFOB, which is a colorectal cancer screening device. Since the FDA clearance on that in 2004, we've contracted with all of the major U.S. distribution networks, including Henry Schein, Thermo Fisher, McKesson, Medline. By 2011, we held about 43% of the U.S.'s market share for fecal occult blood testing, which is the colorectal cancer screening technology. And this is really why we're here today. Is in 2022, we just recently received FDA clearance on our newest device, which is called the AccuReader A100. It's a fully automated fecal occult blood testing system designed for colorectal cancer screening. And this year we celebrate our 20 years in business. So I think what's important is to understand why this product exists and what the point of it is. So colorectal cancer is actually the second leading cause of cancer death in the United States. It is a serious issue. About 50 to 60,000 people in the United States die every year because of colorectal cancer. The, I guess, unfortunate part about colorectal cancer, according to the CDC and 20 years of studies, is that colorectal cancer is highly treatable and highly preventable. There's really not a good reason to die from colorectal cancer. As we can see here, this is the treatment rate per stage. If you detect precancerous polyps of colorectal cancer, you can be 100% treatable. At stage 1, it's 94. At stage 2, it's 82. And as it reduces down to stage 3, stage 4, that recovery rate reduces. So it's vitally important that people are detected early in colorectal cancer development, and then you can actually have an effective treatment for colorectal cancer. Again, it's the second leading cause of cancer death. It's really worth the investment by the government, by the healthcare industry, by the insurance companies to provide this kind of screening methodology so that they can prevent cancer death and also save on the later cancer treatment costs. As we noted, 6 in 10 cancer deaths, colorectal cancer deaths are preventable in the U.S., and precancerous polyp removal reduces your chance of cancer by 70%. So if we look at the market here, right now, globally, the market is about $2 billion. The U.S. accounts for a huge share of that, the $1.35 billion U.S. dollars in global or in U.S.-based colorectal cancer screening spending every year. Then we can look over at, North America is $467 billion or million. Europe is the second with $400 million. Then we move on to Asia and Latin America. So really, North America with that roughly $500 million per year, and Europe with that $400 million per year. Those are our primary markets. That's where we put our products the most. And now we have our FDA clearance on this new device, we're really kind of breaking into that market. And there's a couple of reasons why this device is beneficial. I think it's important to note that previously in the United States, there was only one competitor for this device. So this device is a fully automated fecal occult blood screening device. People at home, they collect a little sample of their stool and they mail it into the laboratory. So it's very easy. I imagine maybe some of you have already done this test at home. And currently, the U.S. government is actually mandating it by the U.S. Preventative Services Task Force. They request that in the United States, all individual adults, 45 to 75, be tested once a year by a FIT test to screen for colorectal cancer. If you can imagine, that is 120 million people in the United States that are eligible for this test. The average reimbursement rate for that is about $16 per test by the Medicare, Medicaid, or private insurance. So that's 120 million times $16. That is the market cap that we're looking at in the United States right now. Previously, we really only had one competitor. They're called Polymedico. They had their FDA approval for about 20 years. They didn't really develop the device in that time. Since last July, we are the second company in the United States to obtain FDA clearance on a fully automated device, and our device is significantly advanced in a lot of different ways. So I think that's kind of our market strategy and our policy directive right now. Our opportunity is one, we are really disrupting this monopoly. This company had a monopoly for 20 years. We are now entering into that market, and we are starting to take some of their market share. Second is market transformation. A big thing about the U.S. is that, I don't know how familiar everybody is with the healthcare system. Right now, what's happening is that a lot of hospitals and smaller office doctors' labs, they're now starting to centralize all their testing into a larger hospital or larger laboratory space. As the centralization goes on, they're doing this for a couple of reasons. Primarily, it's cost-driven. They're reducing their costs by sending it into a centralized place. How that benefits us, though, is as that centralization is occurring, they're requiring automation, right? Because these large laboratories, they want to automate as much as possible to reduce labor costs and also to increase efficiency. That is why the market is moving more towards this kind of fully automated testing in all of the laboratory space. Luckily, we are just in this space as a market leader of fecal occult blood testing. We have very limited competition, and now we have an FDA-cleared device that can really target that market. So that's why we say we're disrupting the monopoly. The market transformation is very influential in how this market is growing. We have a reduced cost. Our competitor, our only competitor in this space, is manufactured in Japan. They have very expensive chemical assays that they need to use in their tests. And these chemical assays are actually manufactured in Japan and need to be shipped by air from Japan to the United States in refrigerated condition. So essentially, their cost is more expensive. Their logistics costs are more expensive than their actual product. Conversely, because of our new technology that's patented in 20 countries, including the U.S., our technology is a dry chemistry product that can be stored at room temperature for 24 months. So just on the pricing mechanism of how we sell this device and how we distribute it, we can be much more competitive than their product just by logistics alone. Not to mention that our manufacturing procedures allow us to be a little bit more cost-effective than that. How this translates to our business is that we can have a much more flexible pricing model against our competitors. And with that flexible pricing model, we can capture market share. And we can respond very well to any kind of actions they try to take to compete with our capturing of their market share. Improved efficiency, that's just standard. We do 100 tests an hour. They do about 80. Laboratory people really care about that. I'm not sure if you guys would. And I think the most important now is this policy demand. So the Biden administration, they have a program called the Cancer Moonshot, where they want to reduce cancer deaths in the United States by half by the year 2035, essentially. A big part of it is this system of their promoting insurance companies to promote their doctors to do more colorectal cancer screening testing. So that is how the policy is driving it. We're seeing an increase in colorectal cancer screening tests prescribed by doctors to the laboratories. That in turn requires laboratories to run more tests, which leads to laboratories wanting automation, which leads to our product market opportunity. So we can look here at the market size of FIT. So it's called FIT, which is Fecal Immunochemical Test. It is the official medical term for what is this colorectal cancer screening test, essentially. FIT, that's the acronym that we like to use. So as I mentioned, the potential market, according to the U.S. Preventative Service Task Service, is 120 million individuals in the United States. Current compliance, unfortunately, is about 40 million people. So of the 120 million people that should get the test, about 40 million people every year actually get the test, which is still a very healthy market share. Through the Biden administration's program of the Cancer Moonshot, and also we have another program called Access, which is a government-funded program to encourage colorectal cancer testing. I imagine a lot of you can imagine if you're over the age of 45, you may have gotten from your healthcare system a little envelope in the mail where you're supposed to collect a stool sample. That's probably part of the program. And if you haven't gotten it yet, you probably will soon. That is a big effort that the U.S. government, through insurance companies, is making to push more people to be screened for colorectal cancer. So through that effort, what they're trying to do is push that 40 million per year colorectal cancer screening patient up to 70 million per year. Now, if we consider that the total market cap is probably about $1.4 billion, the manufacturer share, which we are as the manufacturer, is about half of that. Because obviously through that supply chain, we work with some of the major suppliers. They take, 30 to 50% of the sales value as their revenue, right? But the manufacturing revenue is essentially about $500 to $800 million annually. So that is kind of the market size that we are aiming for. And as these numbers grow from 40 to 70 million annually in the U.S., this market cap would also grow. So I think it's important to understand, while we're a private company, we are a pretty well-established company. We've been doing this for 20 years. We have FDA approvals. As the previous guest mentioned, it is not easy to get an FDA approval. It takes millions of dollars and years to develop a product and then actually get it through the FDA. That provides us a lot of protection as well to, I guess, newcomers or competitors. It's difficult for a new company, a smaller startup, think of an idea and get an FDA approval in any kind of reasonable 5 to 7 year time period. So that's a protecting element to us. I think another thing that really sets us apart is that through these 20 years, we've really established a good reputation and commercial partnerships. So over here, these distributors, these are the primary distributors in the United States if you want to buy a diagnostic test. So any lab or hospital you go to in the United States, all of that stuff in that lab is probably coming from one of these 5. So McKesson, Fisher Scientific, Henry Scheid, Cardinal Health, and Medline. McKesson, I believe, was number 8 in Forbes 500 last year. Very, very large companies. They dominate the sector, and we have very tight partnerships and relationships with all of these companies for the past 10 to 15 years. If you're not in the industry, it's kind of hard to understand what that signifies, but if you were an unknown company and you tried to gain a partnership with these companies, it would be very difficult. It would take years. So as we have pre-existing relationships from our previous test periods, we can plug this new product into their system quite quickly. And actually, through Fisher Scientific and Henry Schein, our new device is already being distributed to laboratories. Another big part about the U.S. healthcare system, which is very complicated, is our partnership with what we call GPOs. GPOs are group purchasing organizations. They're when big groups of hospitals or healthcare systems get together for bargaining power and purchase directly from either the distributors or the manufacturers. Working with GPOs makes you a provide vendor. So any hospital in their system, if they want a colorectal cancer screening test, they have to buy the GPO preferred colorectal cancer screening test. It takes also, much like an FDA procedure, it takes a long time and a lot of effort to become a preferred vendor to a GPO, but we are preferred vendors at Vizient and Health Trust, which are actually 2 of the largest GPOs in the United States, and Yankee Alliance, which is the larger one on the East Coast. But this also gives us some established market share that we, as a reputable brand and a preferred vendor, can maintain this market pretty easily. I think it's also just about our company in general. And then we'll move on to the financial part. Our company in general, we're an ISO certified manufacturer. Everybody should be. We're ISO 13485 certified manufacturer. This is specific to in vitro diagnostic manufacturing. We hold this at our U.S. facility and at our external facilities. We are an FDA authorized manufacturer. So we manufacture products for the United States as well as internationally. And all of our products are currently FDA approved. I think one last note that we'll note, because the previous speaker actually had some really interesting points about fentanyl. I think it's very interesting fentanyl crisis as well. We are also part of it. We manufacture a lot of immunoassay test strips. So we manufacture immunoassay test strips that are everything from pregnancy tests to drug tests. You know, all those test strips we use, COVID tests, those kind of test strips. One of our main products right now is a fentanyl test strip, which is a test strip that people use. Oh, yeah. Just to go into our other products, we're primarily focused on this FOB market, but it's important to understand the scope of the company and the technology we make. So this is a fentanyl test strip, and this is a test strip. I imagine maybe you've seen it in the news or not. They're becoming more and more popular. This is a test strip that you actually place into a solution, crush up a pill or crush up some powder, and you can actually test to see if that substance contains fentanyl or not. So these test strips in the world, generally in the world, there's about 3 manufacturers that make them. We are one of them. The U.S. government just released a $1.5 billion grant to SAMHSA. SAMHSA is an organization that oversees drug abuse and addiction in the United States. And then through that grant, the CDC and SAMHSA approved the use of that $1.5 billion in funds to purchase what they call harm reduction devices, like as well as fentanyl test strips. Through that, we've seen incredible growth in this kind of product sales. You know, we're selling millions of these a month now. And I think it's just important to understand, we also offer the the pandemic as well, that lateral flow immunoassay test strips, such as the rapid COVID tests everybody did at home, such as these sentinel test strips, such as our cancer devices, it's a growing industry, and it's a stable industry that always has some demand. And so while we're a manufacturer of many of them, I think our primary focus right now for the next 5 years is on developing the Hemosure brand and developing this product into the larger market. And so, yeah, that is the marketing section. Now we'll move on to the projections and the business.
Thanks, Chris. So one of the things that we had to try and figure out is what's the best way to penetrate this market. And we did a lot of analysis. We started out looking at ourselves as a premium product, trying to go through the distribution channels. We then were very mindful of trying to make sure that our supply chain could make a profit with this particular solution, given the premium that the competitor was garnering. So we looked at a number of different approaches, and the one that we ultimately came down to was a reagent rental. So for those of you that are not familiar with that, we're effectively going to give the machine for free in order to get on the shelf in exchange for what will be a 5-year contract. So they'll use our machine and they'll buy our recurring revenue product for a 60-month period of time. Now that may seem like a significant investment, but when we talk about the profitability that we have on our cassettes, which are our razor blades in a razor blade model, we've calculated that if they do 50 tests a day with our machine, we will pay back the cost of the machine in 30 days. So what does that mean? We get our investment back on the machine, which is about $5,000. We get that investment back in 30 days, and then we benefit for another 59 months under the reagent rental program. So when you look at the revenue line here, you're not getting any revenue benefit from the sale of the equipment. It is only the recurring revenue, the cassette that uses the disposable that is used in order to conduct the test. We've done some market research on what we think the average tests per day are. We've done a market share analysis based on the initial reaction that we've received from the market. And I will tell you that the reagent rental market or approach is going to go gangbusters. In addition to the revenue from the colorectal cancer screening cassette, one of the things that I think is equally important is the device was designed to support up to 15 different tests. The company, through its previous work, already has the chemistry figured out for another 11 tests. The machine itself was approved by the FDA. The cassette for colorectal cancer was approved by the FDA, which means we don't have to get approval again for the machine. We just have to get approval for additional tests that we want to operate under the machine. The same approach that we took with colorectal cancer, we took our existing chemistry, we modified that to work on the machine, and we obtained FDA approval. So included in the revenue is an assumption that we will get approval for some additional tests along the 5-year horizon. And that is one of the reasons why we're looking to raise capital, is to be able to perform those FDA trials for those tests. From a margin perspective, the other thing that we looked at is we've experimented with a number of different prices for the cassette. As Chris indicated, the reimbursement rate for this particular test is $16. Our competitors are selling their product for $12, which means there's no profit for the distribution channel partners, and there's certainly nothing left over for the lab. So the labs are basically doing this for free. There's nothing in it for them by the time they include their labor. So one of the things that we've done is we've been very mindful of trying to test the market from a pricing standpoint on the cassettes. It looks like we'll come in at about $6 a test, which will leave the distribution partners enough to make their normal 20 to 25% profit and still leave enough money for the labs to want to continue to do the test, which we think is critical to the health of the American people. The cost, including the self-mailer, which is the item that you receive from your doctor, $2.25. So you don't have to be a rocket scientist to figure out you've got $6 per unit, $225 in cost, significantly higher gross profit. So we're looking at ramping up our activity starting in this year. We have forecasted to deliver 500 units this year, and then we need to ramp up our production capacity in order to be able to achieve that. But with that high a margin and with the limited competition that we have out there, we're expecting to see explosive growth, not only from the colorectal cancer, but also the additional tests. What are we looking for? We're looking to raise $10 million, preferably as a convertible preferred. The use of the proceeds, we need to ramp up our sales and marketing. There's going to need to be a lot of boots on the ground to cover the domestic market. We've also got opportunities in international markets, as Chris said. We want to establish domestic manufacturing, so made in America, which is very big. Our competition is made in Japan. And then lastly, we're going to need to spend about $5 million, $5.5 million of the raise to get those additional tests approved through the FDA. We've estimated about $750,000 per test. Take about 18 months to get an individual test. So you're going to start to see revenue from those additional cassettes coming online in 2025. We think it's an exciting opportunity. Where do we exit this investment? We have plans to go public, take the company public in 2024, once we get some traction and some unit growth with our particular device. And then, but at the end of the day, as is often the case with healthcare-related companies, there are some very large players that love to consolidate, and we may very well be in a situation where we get an offer to sell as opposed to going public. So that's our financial story, very compelling. I'm a conservative financial projector, so I've taken my swipe at these numbers, and with that, we'll open it up for questions. Correct.
Good question. So primarily we sell to distribution because we're the manufacturer. So most of our strips, yeah, and I apologize, it could have got a little convoluted in there. So the colorectal cancer screening test is also a test strip, but it's a test strip that's designed in a way that it runs on a fully automated system, as opposed to these, which are individually live test strips, right, that you can just run by yourself, right? But they're all the same technology. And that's really at the core of our company, is we own the ability to develop this technology and to manufacture it in the hundreds of millions. So that's really where we went with that. Now, as a business model, primarily we sell through distribution. We don't do the D2C because that is a pretty high overhead for us. So we like to work with distributors in different segments. Also, distributors have the ability to specialize. So, like, for example, the people that sell these test strips in the United States, they sell millions of them. They have a team of 20 people every day only doing that. Whereas with colorectal cancer, that's a lot more of a medical device. They sell for that. So, yeah, our company's goal, I don't believe, right now as the marketing director, is not to do a D2C kind of business model. We just do B2B, and then we let them figure it out from there. Yeah.
Ownership is one individual sitting right there in the front row, so there's very few people that we have to negotiate with that. Convertible preferred, we think, is the path to go, and then obviously they can have their preferred position on liquidity. We've done it. We're working on doing a separate independent valuation for the company, but I think we've anywhere from 100 to 150 million is probably what it's going to end up being, just based on other work that we've done. Any other questions?
Great. Thank you, everybody.